Eating disorders affect up to 30 million people in the US and 70 million people worldwide. We spend about $40 billion each year on diets and diet-related things, such as supplements and pills. The two most common eating disorders are bulimia and anorexia, which I'm sure most of you have heard of or somewhat understand the concepts of both. Eating disorders such as bulimia and anorexia impact the mental and physical characteristics of an individual. So I'm going to talk about bulimia first. Bulimia is an eating disorder that's described as a destructive pattern of eating and purging to control weight. The two most prominent behaviors are binging, which means eating a lot of food in a short amount of time, and then purging, making yourself throw it up or get sick immediately after. Those are not the only symptoms of the disorder. Unlike anorexia, bulimia doesn't necessarily have symptoms of significant weight loss. Bulimia is an eating disorder, but it is also a mental health disorder. If you are bulimic, you could experience depression, anxiety, obsessive compulsive behaviors, such as constantly monitoring of food and constantly monitoring your weight. That could over time become an obsession. Moodiness and irritability may also occur in your system due to the lack of vitamins. Also, people that are bulimic not everybody, but most of them tend to obtain substance abuse with either alcohol or drugs. People with bulimia also become so focused on their eating that they will start to eliminate other activities that they used to really enjoy. So that can cause a lot of stress on a person, which also increases the thought of suicidal thoughts, suicidal behaviors, mainly because of the stress and because they know that they have an unhealthy body image. It also takes a toll on your digestive system. Sore throat, stomach pains, both may be the first obvious sign of bulimia. As the disorder progresses, vomiting can cause a variety of symptoms with your digestive tract beginning at the mouth. Over the time, the high acid content in the vomit can damage your teeth. It can cause tooth decay, sensitivity, gum disease, puffy cheeks, and jaws. So here's an example of what I mean. The bottom teeth wasn't really that impacted that much, but as you can see, there is some decay here, and it looks like there's a little bit of rotting in the tooth too. Frequent purging can cause dehydration, which leads to weak muscles and extreme fatigue, and it can also put a strain on the heart, which causes irregular heartbeats and even heart failure. It can also irritate or tear the esophagus, cause blood in the vomit, heartburn, acid reflux, and then after you put your finger down your throat more and more, because that is the most common way that people that are bulimic make themselves purge, doing that over and over again can cause calluses on the back of your hand because the acid in your vomit could scar your hand. So this is what I mean by that. It is a little bit pixelated from when I printed it off, but it looks like they have almost like a burn on their knuckles. That is from the acid in the vomit, so it can cause scarring on your hands. Pregnant women who engage in bulimia face very severe complications such as high blood pressure, miscarriages, premature birth, breech birth, higher risk of C-sections, birth defects, stillbirths, and extreme postpartum depression. Next is anorexia. Anorexia is defined as an emotional eating disorder by obsessive desire to lose weight by refusing to eat. That is a lot of the time we see that in Hollywood with celebrities because they say the camera adds 10 pounds, so celebrities feel pressure that they need to lose weight in order to live up to the ideal image of Hollywood. It is also really prominent with fashion. As you can see, this is what a lot of fashion sketches look like. It's a very unhealthy, not realistic body type. And then here is the picture next to it. It is a computerized image. This is basically what the sketches look like and what they're saying that women need to look like in order to fit the description. As you can see, not very realistic. Let's see. 8% of people in the U.S. suffer from this, and of the 4%, 8% of people in the US suffer from anorexia, and of that 8%, 4% of them will die of a heart attack. It is the highest fatality rate of any mental illness, and only 1 of 10 that have anorexia actually try to get help. 95% of people that do have anorexia are going to be between the ages of 12 to 25, so mainly in high school and college, which is really sad. Mental illness with anorexia is going to be very similar to bulimia. They can experience depression, anxiety, the risk of substance abuse with drugs and alcohol, suicidal thoughts and tendencies, things like that. If they have anorexia, they are going to have more increased stress hormones. Heart disease is the most common medical cause of death, people suffering from anorexia. Physical health, they have a lot of neurological problems like temporary or permanent nerve damage, anemia, gastrointestinal problems such as bloating and constipation, and they could have multi-organ failure, low blood pressure, shrinking heart muscles, and reduced levels of minerals and electrolyte imbalances. And I do have this visual for you right here just so you have a little bit better of an idea. It impacts the brain, obsession with food and calories, fear of gaining weight, headaches, fainting, dizziness, mood swings, anxiety, and depression. It affects the heart, like I said before, poor circulation, irregular or slow heartbeats, very low blood pressure, cardiac arrest, and heart failure. With anorexia, it can cause dry skin and lips, brittle nails, very thin hair. People who are anorexic, they bruise very easily, so someone could just barely touch them and they will get a bruise the next day. Yellow complexion, growth of white hair all over the face and body, low iron levels, constipation, diarrhea, bloating, and abdominal pain, dehydration, kidney failure, loss of bone, calcium, muscle loss, and weakness and fatigue. So eating disorders such as bulimia and anorexia do impact the mental and physical characteristics of an individual. In terms of the mental aspects of both, they're going to be very similar. Whoever participates in bulimia and anorexia, they both have a really good chance of depression, anxiety, suicidal thoughts, as well as the substance abuse. And also both bulimia and anorexia, that takes a very negative toll on the conditions of your heart and blood conditions.